get engagement from all of the different team members who are involved with your baby-friendly work in a really kind of structured and formal way. Task forces also helped build facility-wide investment in a project. And we say this as appropriate because, you want your entire hospital to be aware that you're becoming baby-friendly, but your entire hospital doesn't need to be involved in a task force or represented in a task force. So you definitely want representation from a lot of different departments and people who are going to be involved with baby-friendly. So that could be, from maternity to OB, to marketing, to people who work on your electronic medical records. But, it's not appropriate to go as far as going to, like, the adult, ICU unit. They're not going to be really involved with baby-friendly, so you don't have to involve them in your task force. Creating a task force also ensures effective communication across groups. Again, the task force is just a really formal organization of all of the people who are going to be working on baby-friendly. So if you have good representation from all of the different people who are going to be involved in different departments who are going to be involved in baby-friendly on your task force, and you communicate with your task force team members, that ensures that you're going to have good communication across your hospital. Your task force also promotes continuity of care for those you serve. Again, a task force that includes people from all of the different departments who are involved with baby-friendly is going to ensure that you have continuity of care for your patients. Because if you have representation from prenatal, and if you have representation from OB and postpartum, and then even from the community groups who support women once they, are discharged from the hospital, you have all those people on your task force. That's going to ensure that all those people are talking to one another and that you're sharing the same messages to women prenatally in the hospital and then postpartum once they leave your hospital. Task forces also ensure inclusion of various perspectives and styles. Again, so if you have a diverse task force team, you're going to have, people from nursing, have your physicians, you'll have people from marketing, people from, finance. So you'll have a lot of different team members, a lot of different perspectives, which will help to ensure that when you make decisions about implementing baby-friendly, that all of those people are represented and you make the decision that's going to be best for everyone. Creating a task force also helps you to divide up your tasks strategically. Baby-friendly is a large undertaking. It's not possible for one person to do it on their own. Creating a task force of people to work on this allows you to kind of divide and conquer. You can pick the best people for each job as well. There's 10 steps that you have to be implemented in order for you to become baby-friendly. And each step is involved with different practices, and certain people are going to be more involved with some of those practices than others. So creating a diverse task force is going to make sure that you have people who are suited to tackle every task that you come up against. All right, so in terms of the participants, who should you include on your task force? We like to kind of divide this into 3 different groups. So there's your core improvement team. These are the people who are going to be, at every task force meeting kind of involved with all different levels of decision-making and all of the different steps. Then we also think you should create subcommittees. So this is going to be different groups within your task force who work on different parts of the baby-friendly process. And then you're going to have your ad hoc members. So these are members of the task force, important members of the task force, who aren't going to be involved in every aspect of baby-friendly, but they are going to be important members for certain parts of the baby-friendly process and certain steps of the 10 steps to successful breastfeeding. All right, so just to go into the core improvement team a little bit deeper, This is going to be made up of your CHAMPS baby-friendly team lead. So that's kind of the person who's going to lead your task force and lead your core improvement team. You'd want on your core team, you're going to want to have nursing staff. And it's important to have, a diverse group of nursing staff. So you'll want nurses who cover labor and delivery, nurses who cover your mother-baby unit or the postpartum care. You want to make sure you have both day and night shift represented. A lot of times we hear, like, oh, on day shift we do it this way, but on night shift we're not really sure what they do on night shift, or they do things a little differently on night shift. So you just want to make sure that you have nursing staff from both shifts so you can just have both perspectives at the table in your task force. You also want to make sure you have nursing management. It's important to have some people who have leadership roles so that you have the people with the power to really make change, hold people accountable, and be responsible for implementing different practice changes. And it's also important to have a nurse educator on your core improvement team if you have a nurse educator, especially if it's a nurse educator who, works primarily in your mother-baby unit or labor and delivery. You also want to make sure you have lactation staff on your core improvement team if your hospital has specific lactation staff. A lot of times with baby-friendly task forces, a lot of the burden or the responsibility has been placed on lactation staff in the past to really, like run the baby-friendly task force and baby-friendly work in the hospital. But baby-friendly is definitely, it's bigger than something that, just the lactation staff can do all on their own. And baby-friendly is not just for breastfeeding infants either. We have practices like skin-to-skin and rooming in that apply for all infants. So it's great to have lactation staff on your core improvement team, but your core improvement team should not just be made up of lactation staff. You also want to make sure that you have some physician representation on your core improvement team. So this can be, your OBGYN physician lead and your pediatrician physician lead, or some hospitals have neonatologists instead of pediatricians. But you want to make sure that those physicians are represented on your task force. And those physicians that you have on your task force, they can be really powerful allies when you're trying to engage the other physicians in the hospital. For instance, sometimes it's hard to get your physicians to do their 3 hours of training. This is a great thing to bring in, your physician leads on your task force to go back to those physicians, and work as your ally for your task force to get them on board and get everybody trained. It's also a really good idea to have hospital management on your core improvement team. So if you have, it kind of goes beyond nursing management. If you can have hospital administration on your task force and on your core improvement team, it just ensures buy-in from the highest level in your hospital. It also really helps when you come up against barriers for implementing different changes. That's when, hospital management or hospital leadership can really step in and help to overcome some of those barriers by saying, from a higher level, this is something the hospital wants to do. Failure is not an option. How can we make this work for our hospital? Because, for instance, we really need to implement skin-to-skin in the OR after a cesarean. The other people to include on your core improvement team would be representatives from, your prenatal clinics. So if you have affiliated clinics, this is definitely, those are definitely people you want on your core improvement team. It could be, the manager of the clinic or a liaison from the clinic who's just on the team and, coming to your meetings and involved with the baby-friendly process. And then last but certainly not least, it's really important and essential to have community representation and patient representation on your core improvement team. you know, with the hospitals that we're working with in Mississippi, you guys have a really great WIC department that is doing a lot in your state to promote baby-friendly and to, you know, start to, you know, work with hospitals and promote breastfeeding with all the WIC recipients. So they are great community members to pull onto your task force. And it's also great to just recruit some patients to be a part of the task force as well. A lot of the time, I think, you know, nursing staff might have given birth at the hospital and can see some things from the perspective of a patient, but sometimes it's just good to get a patient who doesn't have any other ties to the hospital besides giving birth there to be a part of your task force and just speak from their experience. All right, so back to those ad hoc members who just need to be involved with maybe 1 or 2 steps of the baby-friendly process. These are going to be people like your NICU managers, your nurse educator, your director of continuing medical education, IT or EMR, staff members, someone from purchasing, people from your patient education or health literacy department, representatives from marketing and public relations, people from medical billing. If there's other community groups you can pull in, you could have them on your, as ad hoc members on your task force. And an anesthesia champion is also really good to have, especially when you're working on things like skin-to-skin, post-cesarean. And so these ad hoc members are really people who are going to be essential to the baby-friendly process, but they're not people who need to necessarily be at every task force meeting and be present throughout the entire baby-friendly process, like your core team members. For instance, it's really great to have IT and EMR representation at some of your, in any of your task force meetings when you're talking about documentation. You know, like how are we going to improve documentation for skin-to-skin? You're going to want someone who's able to go and edit your EMR at those meetings so that you can find the best way to create that documentation for skin-to-skin if it doesn't exist already. Some hospitals are trying to pull automated reports so they can get, you know, like numbers on how many patients are getting skin-to-skin, how many patients are getting rooming in. Again, you can get some really helpful tips from IT and people who work on your EMR when you have those meetings about, you know, how to tally those numbers. So you should bring those people in on your task force. You don't necessarily have to have them at every meeting, though. They wouldn't be interested in, you know, a meeting on, you know, how to teach moms cue-based feeding. Purchasing, someone from purchasing is going to be really essential once you get closer to the end of your baby-friendly journey, and you're going to be looking into paying fair market value for your formula. So it's great to just have someone from purchasing on your task force so you can you know, invite them to your task force meetings when you start to work on things like that. I know a lot of hospitals, it's not something you might think of at the top of your head, but marketing and public relations people are really great to have on your task force team. They can help make, you know, really nice 10-step posters that you'll have to post around your hospital. They can help to promote things like skin-to-skin and rooming in with patient materials. Some hospitals have, you know, created billboards about how they offer skin-to-skin at their hospital, and, you know, those billboards are up in their communities and have been a great way to promote the hospital and also the new practices that the hospital has adopted. So these are just a list of ad hoc members. I'm sure there are other people that you can join, you can invite to your task force meeting, but it's good to have in mind that, you know, you should recruit these people to be a part of your task force. You just don't necessarily have to have them involved the entire time. Okay, and just a word on the team lead. The team leads can be it's a crucial, you know, task force position, a crucial part of your task force team. Your team lead should be a person who is dynamic, who has the respect of the people in departments that are going to be working closest with Baby Friendly, and the team lead should be someone who does have power to implement practice and hold people accountable. Sometimes the perfect leadership is someone from lactation, but other hospitals have found that it's really a nursing manager who's the best team lead and the most effective team lead. Other hospitals have found that their nursing managers, have too much on their plate and just are not the people to lead these task forces. So it's just important to sit down and really think about, as a task force and as a team, who's going to be the best person to lead the task force, and then make sure that that person has support from all of the other team members so that they're able to implement the changes that the team decides on, and really effectively move forward with all of the baby-friendly practices. Okay, so here are the subcommittees that we were talking about earlier. In your task force, it's important to kind of, again, divide and conquer. You don't want to have all of your task force team members working, on every piece of the process. And that being said, you don't want to have one person working on every piece of the process alone, because it's too much for one person to do, and it gets overwhelming if you have everyone on your task force working on the same thing. It's best to kind of think about where people's strengths lie, and then divide into small groups and divide up the responsibilities into those groups. So here's an example of how you could set up subcommittees at your hospital. So we have our core improvement team in the center. They're kind of involved with all of the different responsibilities and tasks. And then there are 4 subcommittees. So the first subcommittee is responsible for the infant feeding policy. And then in parentheses, you see the number 1. That just stands for what step it is in the process. So of the 10 steps, the successful breastfeeding policy is step 1. So you might have a subcommittee that's working on the policy. And then you might have another subcommittee that's really working on staff training, which is step 2. So you'd want nurse manager, nurse educator on that subcommittee. You would want your physician leadership on that subcommittee so that they could make sure that their physicians, the fellow physicians, are doing the training. The third subcommittee would be the practice subcommittee. So those are really steps 4, 6, 7, 8, and 9. Those are the practices that you're implementing in the hospital. So it's skin-to-skin, rooming in, alternative feeding methods. Nursing staff would probably be well represented on this subcommittee. And then the 4th and final subcommittee in this example is this continuity of care subcommittee. So this is steps 3 and 10. So it's really prenatal care and then postpartum support once mom has left the hospital. So you want representatives from your prenatal clinic on this subcommittee. You might want your community representative, someone from WIC on this subcommittee. If you have, any pediatric clinics that, are affiliated with the hospital, you could have them on that subcommittee. So this is just an example of how you could set up those subcommittees. Some hospitals have more subcommittees than this, or, they divide up the tasks into, into different groups. They group the 10 steps differently. All right. So in terms of best practices for holding your baby-friendly task force meetings, we're going to be talking about the first meeting, and how to organize that. I'm going to touch on what every meeting should include thereafter. And then we're also going to touch on, setting goals and how your task force can work on that. All right. So for your first task force meeting, many of you may have already had your first task force meeting, but for those who haven't, or for those who may want to do, start again and have like revamp their task force and have kind of another kickoff meeting, this information is for you. So first you want to find and schedule a mutually beneficial time and location for your meeting. So you want to think about a time when, most of your task force members are going to be available. You don't want to schedule, during the time when physicians usually round on patients, or you don't want to schedule it during, a nursing management meeting that usually takes place. You want to find a time where you feel like most people will be available, and then you also want to choose a location that's going to be convenient for most people. So you might not want to do it off-site at the prenatal clinic. You want to find, a large conference room in a central location in your hospital and invite people there. For your first meeting, it's also really great to invite kind of the highest office possible. So someone high up in your hospital leadership could attend this meeting, really show that your hospital is engaged in baby-friendly and devoted to making baby-friendly designation your ultimate goal. It's really nice to send a formal request to attend the meeting to this person in the highest office that you're going to invite, and make sure that they know that this is a really important meeting, that you would really like them to attend, and again, find a time and a location that's good for them, because it is really good to have them present at this meeting just to show, how invested your hospital is. Before the meeting, it's also really important to prepare an agenda and to prepare your presentation materials. You want to go into the meeting knowing what you want to talk about, having your agenda set so that you're organized, people feel like when they're at the meeting that it's not a waste of time, that you're getting work done, you're being effective. And so that will really set the tone for all of the other task force meetings to come. If they show up for your first meeting and it's disorganized and people feel like they might have wasted their time, they're going to be less likely to want to come to future task force meetings. So set a good impression. And it's also important to have your presentation materials ready. So think about, at this first meeting, are there flyers, handouts, information that you would want to share with people to make sure that everyone kind of starts off with a certain base knowledge about what you're working towards. And we're going to talk a little bit later just about some, like, 2 key materials that you could share at this first meeting. It's also really important to make sure that people know about the meeting. So you want to schedule that mutually beneficial time, but you want to also make sure that everyone knows about that time. So it's important to kind of send an initial invitation to everyone, whether that's in an email, verbal invitations, whatever works best for you. You want to do that. You also want to just send a reminder, either the week, the day, or the day before, or the day of. You want to send a reminder for everybody to attend. You also want to include the agenda so that people know what to expect, and so that they know, like, okay, this is an important meeting, and we're going to talk about this, this, and this. I'm going to attend because this pertains to my work, and I want to be there. Some hospitals have, kind of email programs with, calendars in them, so you can do electronic calendar invites if your hospital uses, a calendar in your email system. I think I always use those myself. It helps me remember what meetings I have. And then also those calendar invites that you do, they have their own reminders. So they will also pop up if someone's at a computer right before the meeting, reminding them that they should attend your task force meeting. All right. So in terms of that first meeting and setting the agenda, it's going to be really important to do some introductions at the beginning. People will probably know each other's faces, especially if you have a smaller hospital. They might, introductions might seem very silly, but it's just important to make sure that, you formally introduce everyone, make sure everyone knows each other's name, not just their face, and that they know, their position in the hospital and their role in the hospital. It's important to review just your project goals and your resources, to invite input and to share ownership at this meeting. So you want to make sure that you're reviewing what Baby Friendly's goals are, the resources that you have for achieving Baby Friendly, and you also want to make sure that at the meeting you're inviting people to give their input. This is a good time to kind of hear from others what they've heard about Baby Friendly, what they feel about Baby Friendly, maybe some things that people are worried about, some things that hopefully some things that people are excited about or feel passionate about. But this is a really great time to start those discussions. It's also a great time to start to share ownership. So you might have your core team that set up this task force meeting, but at this first task force meeting, it's a really good time to share with everybody else that, they are a part of this task force, and you are asking them and inviting them to be a part of the Baby Friendly process and to really work with each other to help gain designation. The first meeting is also a really good time to establish your operating norms. So this is just kind of establishing what's going to go on at your task force meetings month to month and just letting people know what they can expect. So, you've hopefully sent out the agenda for this first task force meeting. You're going to let people know that you'll be sending out agendas for all of the following meetings as well. You want to make sure that people know, what meetings they're expected to attend and what meetings they might not need to attend. You could let people know, this is our core team. We invited we invited everybody to our first meeting. But, people from marketing, people from, the electronic medical records department, from purchasing, you don't need to come to every single meeting after this. We'll let you know what meetings we're going to want you to come to in the future. You also want to let everybody know that during your meetings you're going to be taking meeting minutes and notes, and sending those out after the meeting. So even people who, those people who can't attend every meeting or maybe shouldn't attend every meeting, they will get a copy of the meeting minutes so that they can stay updated on what the task force is doing. This first meeting is also a great time to start articulating your short, mid, and your long-term goals. And it's also a great time to just agree to meet again. So when you finish your meeting, you kind of all want to come to the consensus that, we are a part of this task force, we're going to continue being a part of this task force, and let's come up with a good time to meet, every month from now on. So you can kind of set those reoccurring meetings that way. Okay, so here are the materials to share with the team that I was talking about earlier. These are great materials to bring to your first task force meeting or to task force meetings going forward. You want to make sure that everybody has access to or a copy of the Baby Friendly guidelines and evaluation criteria. They really outline the 10 steps to successful breastfeeding and all of the practices that you need to implement in order to become Baby Friendly, along with how you'll be evaluated by Baby Friendly USA on those practices. Baby Friendly USA always says, if you have questions about the practices and how to implement them, go to the guidelines and evaluation criteria first and see what it says there. So, you know, sometimes I call this like baby-friendly Bible when I'm talking to the hospitals I'm coaching, but your guidelines and evaluation criteria should, you know, all the members should be aware of it, and your core team members should each have a copy, and, you know, they'll probably be highlighted and notes taken in it. You should use that guidelines and evaluation criteria a lot. It's also good to share with your team your current infant feeding policy, because if you're just starting your task force, you're probably kind of starting your baby-friendly journey, and working on your infant feeding policy is one of the first things you're going to do. And it's important for everyone to just be aware of, this is the policy that we currently have, and you can start the discussion about these are the changes that we'll need to make to our policy eventually before we become baby-friendly. Okay, so in terms of setting those short, mid, and long-term goals, you're going to want to describe the current maternity practices at your hospital before you start setting your goals. And you're going to want to make sure to review the 10 steps to successful breastfeeding and all of the BFHI criteria before you start setting your goals as well, because the guidelines are really going to help determine what your goals are. So during this meeting, you want to identify long-term goals, and that's generally, you know, 3 years to 4 years out. Excuse me. And that's probably going to be, you know, for most of you, that long-term goal is going to be baby-friendly designation. You also want to identify your mid-range goals, and so that's probably, those goals are going to be, you know, 6 months to a year out. You know, what do you hope to accomplish? A lot of the time, you know, a year out, it's probably going to be a phase change. So as you move towards baby-friendly designation, you're going to move through the 4D pathway in those 4 phases. So a year out, you're probably going to be talking about changing over to the next phase, but you can also talk about, you know, what things are going to need to be put in place in order to make that phase change. Then you also want to identify short-term goals and priorities. And so these goals are going to be kind of goals that you want to accomplish in the next month. And so these are really tasks that you're going to work on before your next task force meeting. And you'll want to accomplish before your next task force meeting. So those are going to be your short-term goals. Then you're going to want to make sure to assign tasks. So you don't want to just make your goals and leave it at that. You want to assign people who are going to be responsible for achieving those goals. And that's when you can really, you know, use those subcommittees and create subcommittees for each goal and assign, you know, different people to each priority or goal that you want to accomplish. You start listing out these goals. That's a great time to assign tasks, and it's a great time to start to think about who are all the people that need to be involved, because if you're writing down the same person to accomplish every single task, you know, as a task force, you should all realize, okay, that's not achievable for one person to do all of those things. So it's just, if you're setting these goals as a task force, it's a great way to really divide and conquer and just see, you know, who needs to be involved in order to accomplish those things. Okay. So this is kind of what every meeting should include. So we've been going over, like, what should we do in the first meeting? Kind of in every other meeting, you want to set a standing time and a place to meet each month. For example, it could be the first Monday of every month at noon, if that worked for you. And that way, people can just put it in their calendar from now until, you know, like 4 years out. They'll know, okay, it's the first Monday of every month. I have something scheduled then. And it'll just help people to be able to attend. Instead of, you know, switching the date every month, then you also have to spend time at the end of every task force meeting trying to find a good date for people, which is time consuming. If you can just set a standing time, it's a lot easier. You also want to send out meeting reminders with the agenda before every meeting. You can encourage your ad hoc team members to attend when the agenda items apply to them. And you can also just make sure if you have some team members who just haven't shown up lately, but you know you want them to be at the meeting, you know, next month when you're going to be talking about your rooming in, then you can make sure to send a special reminder to them to let them know, hey, we're going to be talking about rooming in. I know you have, you know, this is it's really integral to your work in the hospital. We really want your opinion. Can you please come to this meeting? You also want to assign someone to take meeting minutes or notes. This kind of seems like it's obvious that someone should be taking meeting minutes or notes, but it definitely doesn't always happen at task force meetings. So it's really great if you can just assign someone to take those meeting minutes or notes. And it's really good if you assign a person who's not the person who's leading the meeting. So if the person leading the meeting is going to be far too busy trying to, you know, keep everybody on task, stick to the agenda, to also take meeting minutes. So find somebody else to take that responsibility and take those meeting minutes and type them up after the meeting. And then after the meeting, you want to send them out to the entire team so that those who aren't able to attend the meeting can stay updated. And so you can review your meeting minutes too before your next meeting to make sure that you know, you can remember what everybody promised that they were going to do. You also want to make sure to share your results and your successes at your meetings. And this is a great time in terms of sharing your results to share the CHAMPS data that you've been submitting to us each month. So our Mississippi hospitals are submitting data on skin-to-skin, rooming in, and breastfeeding each month. And CHAMPS is giving you reports quarterly. So those reports should definitely be shared at your task force meeting. If you're doing other data collection, you should share those results at your task force meeting. Maybe you're doing a special project on doing the baths in the room, and you've been keeping track of how many baths have been done in the room. You'll want to share those results at your task force meeting. It's also a great time to just share your successes and celebrate people when there's a job well done. It'll help make sure that your task force meetings, it's going to be a lot of work is going to be done at these meetings, but you also want to make sure that you guys have fun as well and really celebrate when something goes well. All right, kind of to piggyback on top of that thought, it's important to think about how to sustain enthusiasm for your task force and for your baby-friendly work overall. So some ways that you can do that are to really nurture your team with food and drink. So if you can have morning task force meetings, if you decide to have morning task force meetings, it would be really nice if you could now and then provide some muffins and coffee for people. They might be more, more likely to attend if they know they're going to get morning coffee at their 8 a.m. meeting. If you have lunchtime meetings, you could offer some food and drink then. No one's going to turn down a cookie. Well, maybe some people would, but a lot of people would really enjoy cookies or fruit at your meetings. So you can tell I love food at my meetings. It's also important to really value your participants' time in order to sustain their enthusiasm in the project. So if you have people who show up at your meetings, several times in a row and they feel like, what they're talking about does not pertain to me or to my job, and really it's a waste of time for me to be at this meeting. It's showing that you're not really valuing their time, and they're going to be less likely to show up to other meetings. So again, that's why it's important to kind of send out the agenda beforehand, make sure that those ad hoc team members know when it's important for them to be there at your task force meetings and to know when it's important to not come to the meeting. And so that will just ensure that, when people do come to the task force meetings, they're engaged, the topics you're discussing pertain to their work, and they're going to feel like your task force meetings are, important and worth their time. You also want to make it easy to attend and participate. Again, you can do that by having a standing meeting time, so people don't have to think about or remember like a specific unique time that they're meeting each month. They can just remember, oh, it's the first Monday of the month, I'm going to have my baby-friendly task force meeting. And then, you can also make it easy by just picking, a convenient time for most people. It's never going to be a convenient time for everybody, but you can try to make it a convenient time for most people. And sometimes, we do talk about having your standing meeting at the same time every month, but if you find that, that meeting works for pretty much everybody, but, your night nursing staff can never attend your meetings. Like, it's never possible for them to attend. Every once in a while, you could switch up the meeting one month and say, we're going to do this meeting early so we can have our night nurses attend, and we're going to really talk about baby-friendly and how it affects the care that they're doing when they're working at night. Okay, you can also sustain enthusiasm by really dividing and conquering, and we've been talking about this a lot during the webinar, but it's important to make sure that you divide up the tasks so that there are different people who are responsible, so that the best people for each task are responsible for those tasks, and that'll just help you be more successful and conquer more of those problems. It's also good to really highlight successes. So you can highlight successes during your task force meetings. You can share data during your task force meetings and celebrate when something goes well during your task force meetings. But you can also take the celebrating successes, even outside of your task force, and celebrate those successes, to the hospital overall. So some hospitals choose to have a bulletin board in, their staff room, their nursing staff room, where they, they put up a lot on the board just about the work that's being done with Baby Friendly, and, the improvements they're making in skin-to-skin and rooming in and breastfeeding. So you could, share successes that way. Other hospitals have, newsletters that go out to all of the staff. So you could, ask to have, one newsletter feature something about the baby-friendly work the task force is doing. You also want to make sure that you keep it fun. So you want to keep it fun for your task force members, but you also want to keep it fun for, just the people who are working on implementing baby-friendly practices in their everyday care. So the people who aren't on the task force. And I think some really fun examples I've heard for how to keep it fun is, some hospitals have movie nights where they share movies about, the first hour after birth. There are movies about that, or movies about breastfeeding. You could have a movie night where you give people popcorn. Before Baby Friendly comes, or when Baby Friendly comes, they're going to be interviewing staff to test their knowledge. So you could have, some hospitals have organized Jeopardy games where they use a game, like a Jeopardy game, just to test everybody's skills and, in a fun way, make sure that everybody is ready to answer the questions that Baby Friendly is going to ask when they come and visit. And then it's also important just to consider purpose-driven leadership. And so what do I mean by purpose-driven leadership? It's really making sure that when you're leading something like the Baby Friendly Task Force, or if you're leading a subcommittee for the Baby Friendly Task Force, it's just important to remember why you're doing that. So for your hospital, it might be the hospital's mission to provide evidence-based health care, the best health, and promote the best health for all of your patients. It's important to remember that, Baby Friendly is really about implementing those evidence-based practices and promoting, the best evidence-based care for all of your patients. So, instead of saying, we just have to implement rooming in because Baby Friendly says so, that's why. Purpose-driven leadership would think more about, we are implementing rooming in because it's what's best for mom and baby. We want to keep mom and baby together, and we really care about our patients' happiness, and patients are, happier when, they're allowed to to be together with their babies. So it's just a different way of kind of framing your work and making sure that, it just goes back to, like, why are we doing the things we do? Why did you get into healthcare in the first place? And thinking about those purposes. All right. So at this point, I would love to turn things over to Stephanie Wilkerson at Rush Medical Center, who's going to be talking a little bit about the task force at their hospital and how they set it up and how it's going.
Thank you, Laura. Basically, I was just going to let you all guys know that it does seem overwhelming at first, but it does get easier. When we formed our task force, what we did is we began with looking at who this would affect and what effect it would have on their job. And we developed a core task force of individuals and invited them to our first task force meeting. And at that initial meeting, what we did is we went in and explained what the Baby-Friendly Hospital Initiative was and why it was important and why we wanted to seek this designation. And that really, for us, gave us a good basis to stand on. Because a lot of people had heard about the Baby-Friendly Hospital Initiative. There had been some misconceptions about that hospital initiative out there, and this was just a time for us to get everybody on the same page, let them know what our goals were, and let them know what the goals of Baby-Friendly were. So for our core task force, we have a hospital administrator, which is we include our clinical director, our nurse manager of our LDRP, the nurse manager of the nursery, our lactation consultant. We included our WIC representative to give us some community representation there. We also included our nursery nurses and our L&D nurses, just so we have an impact of some input from them of how this would change their workflow. And with organizing our meetings, we began with meeting just once a month and just kind of discussing our task, what we needed to accomplish. And then once we began in the D2 phase, we began to meet every 2 weeks. We found that we did need to meet a little more often to get our goals accomplished. And at our meetings, we discuss any roadblocks that we may be coming up against, anything that we see that's kind of a block in our road to our success of becoming baby-friendly. And we also discuss our successes because we feel like it's important for us to celebrate those. And each person is given an assignment, and progress is reviewed with those assignments at each meeting that we have. And there are some challenges, like Laura said. The biggest challenge is finding a time in everyone's schedule that everyone can meet. That seems to be our biggest challenge that we have with our task force. But what we have done is we have designated a day. Ours is the second and fourth Tuesday of every month, and you just have to stick with it. We have stuck with that date, and it seems to work fairly well for us. Mostly everybody can attend on those days, but you just have to designate that day and make sure you stick with it. And that seems to be our biggest challenge. And with our benefits, the benefits of having a task force, if one person is looking at it, all the material can seem very, very overwhelming. But as Laura said earlier, we just have to divide and conquer, and being able to divide those tasks out into subcommittees. You get an outlook from everyone and not just one person. We've also reached out to other facilities that are in our area that are also on the baby-friendly journey. And the biggest thing is just don't try to recreate the wheel. Sometimes the other facilities have things that are already in place that you can kind of tweak and make them work for your facility.
Awesome. Thanks so much. Does anyone have, we can open it up now for questions. So first, I was just wondering if anybody had any questions for Rush in particular. Oh, and I think Moon just unmuted people, so you can now, if you weren't able to speak before, now you will be able to. And if you want to just mute yourself, feel free and to remute. All right. Well, I have a question for you guys at Rush. Was there anyone from your task force who you wasn't, on your task force at first, who you then decided to add to your task force?
We did. When we first started, it was just a small group of us, just the managers, and we decided later that we did need somebody that could impact change in our hospital, and we added our director of nursing, and we also were looking at it and decided, we really needed those voices of the nurses, that this was going to impact how they practice. And we really needed their input of how they saw things changing in their practice and how this would impact them, so we ended up adding them.
Right. Is there anyone from other hospitals on the call who they also had the same experience where they started their task force at first and realized a little bit later that they needed to add more members to their team?
This is Amy at Memorial in Gulfport. We did the same thing. We started out with a small group and kind of called that our working group that got a lot of the beginnings done. And then we've only had one meeting where we've really expanded, and we had some of the people that y'all had recommended. I still think there may be others, but we did do that and kind of gave them an overview, gave them some of those handouts that, like you were saying, too, just to kind of start getting them on board.
Mm-hmm.
This is Anne. I have a question for some of you. How easy or difficult has it been to get prenatal involved? And there are two scenarios, of course. You may have prenatal at your hospital, or you may need to bring in someone, hopefully even from one of the clinics that serves your hospital. And I often say when I'm sitting on these, task force type meetings, it's difficult for the prenatal group because you may have a whole group in the prenatal setting that's nearly as big as everyone else in your hospital, and yet they're like represented by one person at that meeting if we're lucky, and then they themselves have to go off basically and organize a whole group of people who include their patients, doctors, nurses, handouts. What kind of experience have some of you there had with prenatal on these task force meetings?
For us at Rush, it has been a challenge to get them to attend these meetings, and it is also a challenge to get them to change practice, and a lot with physicians too. We stay the course. We have a subcommittee that is that's designated for those prenatal clinics that gets them the information and stays on task with them to make sure that the information is getting there.
Okay. Anyone else?
Well, I know a question. Oh, sorry, go ahead.
Go ahead. I know also for us at Rush, we have a very active midwife group, and as a team lead, it's very hard for them to sometimes make our meetings, and I know that I meet with them at their monthly and quarterly meetings that they have as a group of midwives to update them and give them information on where we are and any challenges that they face to try to bring back to the group.
Yeah, that's a great suggestion. I think this is Laura again, hearing from other hospitals too on the call, a lot of the time it's not so much the prenatal teams coming to the hospital. A lot of the time, the hospital or the baby-friendly task force lead will go to the prenatal clinics, kind of like how you're going to the midwives meeting. So maybe that's if you have a problem where you just can't get a group to come to your task force meeting, sometimes it's best just to go to them.
Yes.
I was wondering if there are hospitals on the call that don't have community members that are looking to add community members to their task force. I guess I would just say if you are, definitely reach out to WIC. They're a great resource. If you're not sure who to talk to at WIC or you've had a hard time reaching out to WIC in the past, let one of your coaches know. Your coach might be me or might be Becky or Kirsten know, and we can help to connect you, through our connections at Mississippi Department of Health. Then also just if you can recruit a patient to be a part of your task force, that's always great. So I think we're coming up on the hour mark. Just want to thank you all for joining today. We have our upcoming webinars. The next one's on February 7th. It's going to be about centering pregnancy and some grants that are available to hospitals who want to implement centering pregnancy. And so centering is all about group prenatal care, and it's been shown to be really effective at educating patients with all of the topics that you want them to learn for baby-friendly. Centering is really effective at that. So if you're interested, you either attend that webinar or listen to the recording. You can apply for this really great grant for help from the centering organization in implementing that at your hospital. And then March 14th is about jumpstarting your baby-friendly journey in our hospital experiences. So we're going to have hospitals who are just starting out on their baby-friendly work talk about what's worked for them and how they've really started working on that. And then just as a reminder, these slides and a recording of this webinar will be uploaded to our website soon, and you can view it at shareequity.org/webinars. So thank you very much for joining, and have a great rest of your day.